Hello, good afternoon. My name is Dr. Chudi Ufundu, and today is the eve of Christmas 2022. And our clinic today, it's gonna focus on 2023. So we're gonna talk about planning. So getting pregnant in 2023, building your fertility plan. So if 2022 is not your target period to become pregnant, if you're believing God to become pregnant in 2023, what are the basic things? What are the basic plans you have to put in place? This will be the topic this afternoon. So thank you so much. My name is Dr. Chudi Ufundu. I'm a convener in this group, and it's a big privilege to share a few minutes with you this afternoon. I know it's Christmas Eve. It's possible you're all over the place trying to buy one or few things and make arrangements. But thank you so much. And I want you to quickly tell me where you're located. I'm located in Florida, and I'm going to spend about 30 minutes to explain things you need to know about your preparation for getting pregnant in 2023. So you can actually plan in 2022, then in 2023, you can see your plan coming to manifestation. Planning is key. Only thank you so much. So that's what we're going to talk about this afternoon. And we're not going to waste much time. I'm going to quickly start my presentation. So once you come in, I'm going to do my presentation. Then afterwards, I'm going to answer one of your questions. Immediately after this, I also want you to join me in our Facebook page and group. And I'm going to repeat exactly the same topic. And you will have an opportunity to share your plans, to ask your questions, because December is very tempting. December is very fleeting. Before you blink, is all over. Okay, so let's start. So you see, anytime you have a dream or a goal, planning is everything. Anything you plan will have an advantage about the outcome. So when you fail to plan, you are planning to fail. I want you to remember this. Failing to plan leads to failure. Planning leads to success. So when you fail to plan, you are planning to fail. So if you're planning and if you're believing and if you're trusting God to be pregnant in 2023, planning a pregnancy can be exciting. It's something that gets you emotional for both people, especially the women, but it can also be overwhelming. We have to accept that. Now, many couples, especially this Christmas period, we feel a lot of pressure. Your mom, your dad, your auntie, your siblings, everybody will be wondering, oh, guys, you guys got married 2 years ago, 3 years ago. When are you going to start having babies? So the pressures are all out there to conceive quickly. Now, some couples can also put pressures on themselves. It might be your partner, it might be your husband, it might be the wife, and they want to quickly become pregnant, but you might not be ready because readiness is very important. So while others deal with never ending questions, oftentimes unsolicited advice from your friends and your family members, not to mention the air of uncertainty surrounding pregnancy. So, possibly, maybe in the past, your pregnancy didn't turn out the way you wanted it. You had miscarriage, you had stillbirth, and you're worried. You're mentally and emotionally and psychologically not ready. You know when you're ready. You know when you desire something, but you know at this point in time, you are not ready. There are some couples that the lady might be ready, the man might not be ready, the man might be ready, the woman might not be ready. It's somehow important. You guys are like about 50-50. So your partner might be 20% ready and you might be 80% ready. It's important you meet each other in the middle. So we are gradually heading into 2023 with goals of getting pregnant, we encourage you and your partner to spend time to create your fertility plan in 2022. When you create your fertility plan in 2022, by 2023, we have 12 months. By the special grace of God, you actually need 9 months to become pregnant and conceive. So if you have a strong, mutually agreeable plan, by the special grace of God, you're going to choose any 9 month gap in 2023 to become pregnant and have your baby. So today, I'm going to help you to discuss a structured guide which will help you to navigate through this process. Number one, you have to discuss your expectation with your partner. So this is not a case of the woman wanting something, planning alone without carrying the partner along. It's going to break your love. it's going to break your relationship. It's not going to yield dividends. You have to discuss your expectation with your partner. Now, you might have your personal fertility goal. So the woman might have a personal fertility goal. The man might have his own fertility goal. It's a good idea to speak with your partner to make sure that your goals and expectations are properly aligned together. In addition to ironing out the questions mentioned above, you guys must discuss this. How much time, how much money are both of you willing to spend on planning a pregnancy? Unfortunately or fortunately, pregnancy requires money. So it requires time. So you have to think about the time. Are you willing to put in the whole 12 months in 2023? Are you willing to put a bulk of the money you guys have in your family towards achieving pregnancy? You have to discuss this ahead of time. You also have to discuss how open you will be to alternative family planning strategy. So if natural pregnancy is not happening and the woman is 6 months, are you guys able to go for IVF? Are you guys able to go for fertility treatment? Are you guys able to go for IUI? You have to discuss this on time. Now, you also have to discuss other options like adoption, surrogacy, donor egg, donor sperm, depending on your individual situation. So by talking through these difficult questions ahead on time, you will ensure that your journey of becoming pregnant in 2023 is mutually agreeable. When you're done discussing that, you have to be realistic. Some people build castles in the air. Some people blame everything on God. Some people say it's not my portion, but you're 60, you're 50. You cannot be using it's not your portion at 60 and 50, or you cannot be, saying you want to have a baby at 60 naturally. Of course, it's not realistic. So you have to have realistic goals. You have to be kind to yourself. So we all have that friend or family whose pregnancies seem very smooth. There are some people that predict they will have 6 kids, and before 12 years, they've had all their 6 kids. Everybody is not wired the same. So you have to meet yourself at where you currently stand. You have to be realistic. You have to be kind to yourself. So, however, the truth is, some women will struggle. While some women will easily become pregnant, they have high fecundity. Unfortunately, some other women will need additional help. So, generally, it's estimated that about 10 to 20% of known pregnancies, unfortunately, will end miscarriage. So, whatever happened in your own current history, medical history, surgical history, gynecological history, you have to review everything and be realistic. So if you're 50, you have to think about what can I do at 50 that will be realistic. It will not make sense to be 60 and you're planning to become pregnant naturally because that's not your option. Because at 60, you might not really have that natural ability because of menopause. So you have to meet yourself at where you currently stand. This doesn't mean you should feel discouraged. At any point in time, any woman at any time can be a mother. There is no woman that cannot become a mother. But it's not all women that will become pregnant to become mothers. Some women can become pregnant and become mothers, and some other women can become mothers without becoming pregnant. They are two different things. So it simply means you should be aware of the fact that planning pregnancy is sometimes long and bumpy. It's not a straight road. So whatever worked for your sister, your friend might not work for you. So be open to have conversation about your chances. Now, when you're done doing that, you have to get to know your body. You have to go for health checks and testing. This is where we come in handy. So if you're getting a package in our group, we normally ask you to run a lot of fertility tests. For the woman, we want to check all these axes. We want to look at the vagina. We want to look at the cervix. We want to look at the womb. We want to look at the tubes. We want to look at the ovaries. There are some investigations. There are some blood tests, hormonal tests. We want to look at estrogen, progesterone, FSH, LH, prolactin, thyroid hormones. We want to make sure that the levels you have is good enough to support pregnancy. If we have any concerns, we work on that. Something will apply to the man. We want to make sure that the man is good to go. So going for your health check and your testing is very important. Your BMI, your body weight, what you eat, your sleep, your stress level. So when you want to get pregnant, pregnancy is a complex biological process. It requires multiple systems from the woman and the man. So both of you must make sure that you have started modifying your lifestyle to suit someone that want to become pregnant. What you were previously doing before you wanted to become pregnant is not what you will do now. There are so many modifications. No alcohol, zero alcohol, no eating, highly processed food, getting enough sleep, exercising, avoiding stress. These are the things you have to encourage yourself to start doing. So make sure you start your believing for baby journey with the best foot forward. So make sure your tests, your results are within normal range. Now, for couples who are just starting their family, probably you got married in 2020 or 2021 or 2022, then now you guys want to start having your babies. You have to establish your goals. When it comes to planning a pregnancy, the very first place to start is to establish your goals. We recommend you take a moment for yourself and your partner to consider the questions I'm going to ask. Do you want to have children? There are some couples that will marry and they don't want to have kids. So it's not all married people, it's not all relationships that want to have kids. There are some couples that just want each other. So you have to agree that you want to have children. Then you have to agree on the number you want to have. The number of kids you have to have are the number of kids you can take care of. So if you can take care of one kid, you can have one kid. If you can take care of 12 kids, you can have 12 kids. Then you have to discuss this ahead of time. You have to ask yourself, am I willing to change aspects of my lifestyle to improve my chances of getting pregnant? You also have to ask yourself a personal question. How long am I willing to try to get pregnant before seeking assisted reproductive technique? You have to know where to cut off the line. This is an area that so many women are not working on. They continue to do their own thing until it's 20 years, 10 years, 5 years. And the life of a woman is not the same thing with a man. So as a woman, you have to know the point you need to seek help. You have to know the point you need to get a package. You have to ask yourself question, how long am I willing to continue to believe to become pregnant before looking for foster baby, adoption, IVF, IUI, donor egg, donor sperm? Once you have established your goal, then you can start working towards making sure that your goals are realistic. So these are the things I want us to talk about this December. Okay, so I'm going to open the clinic now, and I'm going to give you an opportunity to start asking your questions. So please feel free to ask me questions about the plan towards becoming pregnant in 2023 and also becoming a mother and also becoming a father. The clinic is going to open now. I encourage you to start asking your questions. So I can see Dr. Niche just joined. I can see Tosi. I can see Amara. I can see Onyi. So guys, the clinic is open now. Start asking your questions. Remember, if today is the first day of attending my open clinic in YouTube, my open clinic in YouTube is every Saturdays, 12 p.m. Eastern Time, 6 p.m. Nigerian time. You will see me here talking about the topics I love talking about. So make sure you subscribe. Make sure you set your notifications. Make sure you share this channel, comment, like, love, whatever you need is provided in this channel. We have hundreds, multiple hundreds of important videos that will help you and your family. Okay, so guys, please start asking your questions. How can a woman balance childbearing goals with a spouse that strongly feels that his business has to be stable before childbearing? Very, very important question. Everything I've been discussing this afternoon is actually centered on this. Becoming pregnant, having kids is an expensive venture. So you have to be sure that both of you have something doing. Now, personally, I'm not someone that will tell the woman, oh, stay back while I go to work, then you raise the kids. It doesn't make sense. Both of you must come to the middle. If the woman has some profession, she can still pursue her profession while the man is pursuing his profession. Then both of you must meet each other in the middle. Now, at the early stage of your kids, the woman might be the major person looking after the kids because you have to breastfeed the baby and all that. But once your babies are getting older, both of you should have 50-50 contribution. So I wouldn't want a woman that is a doctor, a pharmacist, a lawyer, or all that profession. You stop your profession, so only you can be looking after the kids, then the man can be working. It doesn't make sense. That's not an ideal family. I'm talking about my experience. Like in my home, both of us contribute 50-50. I work, my wife works, so both of us, anytime we have to come together to look after the kids from day one, we'll do that. So that's what I will tell you. You see, life is not all about wealth, money, and all that. Life is actually about the kids. So if you are intending to start your family, you have to prioritize the comfort and welfare of your kids first. So to provide you feedbacks to the question about your partner thinking about business to stabilize before childbearing. So this is what you will do. Life is all about multitasking. He can still be establishing his business and you guys can have one baby. There is no time to wait because your age is the determining factor. So let me give you an example. You're married at the age of 30 and your partner is planning to set up his business for next 5 years. You can't wait till 35 to start planning to become pregnant because at 35, your fertility is reducing. So it depends on your unique factors. But if you're 20 and your partner wants to set up his business at 25, you can still have your babies. So it depends on where you are currently, especially for the woman. I would personally want a woman that got married at 35 to wait for the partner to make money at 40. There is no guarantee you're going to make money. There is no guarantee the business is going to do well at 40. So you have to carry everything along at the same time. Have one baby while you guys are trying to stabilize the business. Then hopefully God is going to make provisions because for any baby that God will give you, God will make provisions for them. So don't wait till you finish this before you start this. Start all of them at the same time. But pace yourself. This is where the 18 months will come into play. So assuming you're planning to have 4 babies. Of course, I don't want you to have all the 4 babies in the next 4 years. 18 months gap. Have the first baby, give yourself 18 months. Have the other baby, give yourself 18 months. Then before you complete the 4 families, you would have spaced the babies. So you can give yourself a breathing space. For your partner to tell you, oh, let me focus on my business, that's a selfish comment to make. The most important business of the family is the family. Family should come first before business. Okay? You're pregnant or you got positive test on Monday. Thank God you're pregnant. Now remember there are 3 important tests you have to run for every pregnancy. I don't know what you did is, I don't know if what you did is just urine test. If you've done urine test, make sure you go for blood test. When you're done with blood test, make sure you go for ultrasound. Ultrasound is the final clinical evidence that you're pregnant. Once your pregnancy is confirmed via ultrasound, then you have to register for ANC immediately. So congratulations, Amara, for the pregnancy. Okay? Keep asking your question. Is there natural food that can aid conception in women under 30? Onyi, you know we have a PDF in this regards now, right? Now, I'm just going to generally give you tips. Focus on superfood. There are some foods we call superfood. An example is your vegetables. Anywhere you see green vegetables, embrace them. Now, your fruits. Anywhere you see fruit, especially the green one, embrace them. They are called superfood. Of course, you have to balance out all the other things you need to eat. So there is principally nothing I will tell you not to eat. You have to eat everything, but at moderate quantity. Think your fruits, think your vegetables, think your protein, especially plant-based protein in lieu of animal protein. You still need your carbohydrates, but you have to make sure that your carbohydrates are the healthy carbohydrates. You have to drink a lot of water. You have to avoid alcohol 100%. When you do all this, it's going to help you to have adequate body weight, adequate BMI that will enable you to have your body perform the fertility function the way God structured it. That's what you need. Okay? Please keep asking your questions. We still have about 10 minutes, but if we don't exhaust the 10 minutes, we're going to quickly rush to Facebook so we can continue the conversation. So keep asking your questions. You can ask on behalf of your friends, or you can ask just questions that will benefit the community. So it must not necessarily be the question you want to ask for yourself. You might ask questions that you probably want to ask so that other people can benefit from the questions. Okay, so please keep asking your questions. Remember your PPP this period. So many people are going to forget the middle P, the love-making part. You probably pray like prayer warrior. I don't have problems with prayer. Prayer is solid, but you're not making love every day. You're not increasing your chance. You're not seeing a fertility specialist. You're not increasing your chance. Remember, if you're in Nigeria, we can help you. There are so many women that will become pregnant this period. Someone is going to become pregnant tomorrow. Someone will become pregnant in January from the lovemaking she will engage in tomorrow. So don't go to church and say, oh, it's holy day, we're not going to make love. That's not true. Before you go to church, make love. When you come back, make love. Any day you make love is an opportunity to make babies. Okay? How do you know that a woman is ovulating? The only way to confirm ovulation is to go to a gynecologist and we run some blood work. There's a particular hormone we are looking at day 21 of the woman's cycle. Remember, the first day of your cycle is the first day of your bleeding. So when you go to your gynecologist, we'll collect your blood sample on day 21 and check for progesterone. Progesterone will tell us, the level will tell us if you are truly ovulating. We can also check your ovaries and look at the follicles. You can't do this by yourself. You have to go to the hospital. You have to go to a doctor's. Now, you might have some non-specific signs of ovulation, like increase in cervical egg white mucus, mid-cycle bleeding, pain, bloating, increase in libido, irritability, breast tenderness. They are all non-specific signs you might be ovulating. Non-specific means you might have them. You're not ovulating, but you might not have them and you are ovulating. So to be sure, you have to go to a gynecologist. Pregnancy after experiencing miscarriage is mentally challenging. What do you advise? Of course, you have to register for ANC immediately because the possibility that the problem that led to the miscarriage might not have been corrected is very high. So the very first thing you have to do, like I asked, I don't know how you confirm your pregnancy. I don't know if you've done your blood work. If you haven't done your blood work, that's very important. It's more important than the urine. So we need to check the quantity of the beta HCG in your blood. Then we can correspond it with the expected period of doubling. It's expected that after pregnancy, the blood beta HCG will double every 72 hours. So run that. Run your ultrasound, then you have to go to your gynecologist immediately. If you have had miscarriage in the past, especially more than 2 miscarriages, your pregnancy is considered high risk. So your gynecologist might also refer you to high-risk pregnancy specialist. Is there hope for women with PCOS? Why not? Hope is a renewable commodity. Regardless of the medical problem you have, there is always hope. Some women that have polycystic ovarian syndrome will even become pregnant without any treatment. But if your own is severe, then definitely you need treatment because the problem in polycystic ovarian syndrome is lack of ovulation. And if you're not ovulating, you cannot become pregnant. Okay? Amara, please stop sharing your numbers openly. What I will advise you to do, if you're in Nigeria, get a consulting package. Now, when you get the consulting package, also consider getting an ANC package so you can have private conversation with your lab figures. Don't share your medical history openly. That's against the rules of engagement. That's unethical. Okay? All right. Keep asking your questions. Yes, delete the questions. You're putting yourself to spot. You're sharing your medical history to the whole world and you don't know who is out there. It's not everybody that you see out there you should share your history with. Some people don't just like you the way you are. I don't know why, but they might not like you. Some people will like you. So be careful. And sometimes it's from the family. Okay? All right, guys, we have a few more minutes remaining. So if you wouldn't mind, submit your questions. If not, we're going to adjourn and continue in Facebook. Are we all good? Okay. I'm going to round up at the 25th minute. It's just about 24 minutes and few seconds. So if I don't have any other question, I'm going to round up. Thank you so much. And remember, tomorrow, remember the reason for the season. It's love, it's care. So go and love someone tomorrow, not just yourself, not just your family, but please, Tosi, thank you so much. I hope your kids and your family are all doing good. I love you guys. And don't be surprised to see me tomorrow pop in and say hi. Anytime I have an opportunity, I always want to come back to the family. But hey, guys, take it easy. And remember this, Everything that has a beginning also has an end. Thank you so much for coming this afternoon. I appreciate you guys. And please quickly join me in Facebook, where I will continue this same conversation. Until I see you guys, God bless you and bye-bye.